Wow.
Yeah.
So this is something for the elderly. I was actually talking to Bobby Kennedy about this a few months ago, and we were talking about supplementation, modalities, treatments, care options, functional medicine alternatives that provide a benefit but have very little chance of harm or no downside consequence. And he was saying how the lanes should be more open to things that may or may not work, but actually don't cause harm. Because there's a lot of pharmaceutical options that may or may not work, but then there's a permanent or semi-permanent detriment. You have a tachyphylactic response, you build desensitization, you build a dependency or a reliance. And those kinds of consequences are the kinds of consequences that really need to be measured. But creatine seems to be one of those that falls into the category of there is indirect and direct, anecdotal, objective and subjective evidence that says this is beneficial for men and women, and certainly in older ages seems to be more beneficial because of the depletion and the lack of absorption. And so now we have a trial that says, hey, across nearly every, cognitive measurement, this is having an acute, positive effect.